Hi there, welcome to our pharmacy revision series by CBH Education. Today we're going to be talking about beta blockers. Okay, so beta blockers are licensed for hypertension, myocardial infarction, angina, arrhythmias, and thyrotoxicosis. The mechanism of action is they block the beta adrenal receptors in the heart. This is the type 1 beta adrenal receptors which are located in the heart. Beta blockers also reduce the force of contraction and speed of conduction in the heart. They slow the ventricular rate mainly by prolonging the refractory period of the AV node. The side effects include abdominal discomfort, bradycardia, confusion, depression, diarrhea, dizziness, dry eye, dysphonia, and erectile dysfunction. More of the side effects and the information around this can be found in the BNF and the summary of product characteristics. Common drug interactions with the beta blockers include calcium antagonists, class 3 antiarrhythmics, and topical beta blockers. One of the main contraindications is they should be avoided in patients with a history of bronchospasm. Now, beta blockers we know can precipitate bronchospasm, and this should be avoided completely. However, if you've got well-controlled asthma or COPD, a cardioselective blocker is usually initiated by a specialist, which can include atenolol, bisoprolol, metoprolol, nebivolol. And these are cardioselective but not cardiospecific, and they have less effect on airway resistance. But one of the main things is that they're not free from this side effect. Key monitoring includes heart rate and blood pressure. When we look at aspects for your exams, your OSCEs, your placements, or when you're looking just generally around the beta blockers, you've got consider the water-soluble and the lipid-soluble beta blockers. So the water-soluble beta blockers include atenolol, celeprolol, nadolol, and sotalol. These are less likely to enter the brain and cause sleep disturbances. One of the main things you've got to consider here is that if some soluble beta blockers are excreted by the kidney, and therefore a dose reduction is required in renal impairment. We have discussed about obviously the cardioselective beta blockers as well, and also with the beta blockers you've got to consider what kind of other medication the patient is taking. Have they got heart failure, and if they've got heart failure, what type of heart failure? Because this is where some of the beta blocker, this is where this counts the category of the contraindications of beta blockers as well. Thank you very much for listening for this presentation. Please subscribe to our YouTube channel for further presentations in our pharmacy revision series.